Okay, good morning, Caroline. How are you doing today?
Morning, Mike. Nice to see you.
Indeed, yes. I just thought I would say hello there because somebody pointed out in any of these videos, I've never actually greeted you at the start. I've always just went on a wee spiel for 90 seconds and never actually said hello. So,
Oh, nice to
yes,
see you. Thank you for saying hello.
indeed. I will just go through a couple of things to start with. We have had a lot more questions again over the last week, which is great to hear. The only thing I would say before we get started is that a few of these questions have had to wait for a couple of weeks for an answer because we did the dedicated session with Workforce last week. So thank you to the people who have been really patient on waiting for an answer on those. We've actually got 16 questions today, so you might need to be quite succinct in some of your answers, Caroline. But
I'll do my best.
Indeed. And I guess that leads me on to the point that I always make that there is no way that Caroline can know all of these answers, but what she will do is, and I think there are one or two that you might need to direct other places to help people get the answers they want. Okay, so I'll just crack on then. So the first question the day comes from one of our colleagues in complaints and feedback. It's from Lisa Blues. She has basically asked if there are any plans to reduce the social distancing rules back down to 1 metre. She works in Summerfield House, a non-clinical building, but as they are a patient service, they've had to be at work throughout the pandemic. Lisa said it would really make a difference to them as a team if they were able to work in the same room again. Is there anything you can update on with that, Caroline?
Thanks, Mike, and nice to hear from you, Lisa. I'm not absolutely sure when that will happen. I'm sure it will happen, Lisa, and I recognise for you, like many others, that'll make a big difference. So what I will do is make sure that under Mike's guidance, we get a communication from our colleagues that are working on how we implement national guidance locally and what the timescales are for that. A number of pieces of work going on around health and well-being and safety of you and your colleagues, which includes how we are at work. And so I'm sure we will be able to get an answer to you pretty quickly around what are the plans relating to that and when will we see them come into action in Grampian.
Thanks, Caroline. The next one is again on some of the COVID restrictions potentially being eased. This is from an anonymous colleague who's asked if we could consider opening the staff gym at ARI again. You know, he rightly points out the numerous benefits the gym provides for staff, including mental health, well-being, and as a stress outlet for people at work. Is that something that's being considered that you're aware of?
So this could be a very short Q&A if the questions are all as detailed as this, Mike. So I am aware of conversations before the pandemic, I think, or at the beginning, around the utilisation of the space that was used for the gym. And I can see no reason that we wouldn't want to prioritise creating the space for colleagues to undertake exercise at the gym, for those of you that find that good for your health and well-being. But I don't have the definitive answer to that. So again, we're going to have to come back to that with something in the brief around where the thinking's at. I'm going to be honest and say I've not heard any conversations about the opening of the gym recently, so I'm not sure where it is in discussions. However, it will be part of the thinking, and we'll make sure that we put an update in the brief along with the 1 metre distancing that Lisa's just asked.
The next one is actually one that we've been asked before. I think it was in the first Q&A. This comes from Rita MacKenzie from Mental Health and Learning Disabilities Service. She asks if there's any further news on the Queen's Jubilee public holiday in June and whether an extra day's leave is going to be granted.
So actually, I think I can answer this. And that's because there was a paper that went to GAPF last week, and there was support for an additional day's holiday, and that was then taken into the weekly decision-making group, which meets on a Thursday, which I was not able to attend. So off the top of my head, Mike, there has been agreement that there will be an additional day's holiday. It's my understanding that that will be flexible for colleagues to choose when they use that. It won't be on the actual day of the Jubilee, and that's for a number of reasons. So that's my understanding at the moment, and I would have thought that would have been communicated by now, so we could probably get that out into the brief to notify colleagues. As I committed when this was last raised, we would do that as promptly as possible. So if you can just touch base, Diane Annand probably is the best person who's been around that.
Yeah, I think from my own discussions, it seems to be that there's the agreements that you've mentioned there, and some of the finer details are just being ironed out. So hopefully in the next day or two, we'll be able to get something out there to people.
Process.
Indeed. The next one, again, it's kind of related to the COVID restriction. Well, it is related to the COVID restrictions. It's from an anonymous colleague who's asked when a patient in outpatient chemotherapy might be allowed to have a family member attend alongside them. Again, she's mentioned some of the benefits that brings, including helping people with anxieties that they're feeling, the general support that offers. And I know, obviously, visiting is something that you feel passionately about, Caroline. Is there any sort of update you can give on that?
So I can't speak specifically about chemo outpatients. However, what I will say is that you're right, I am really passionate about it, Mike, because I think it's so important. People in our system are there when they are at their most vulnerable, and I know the level of distress that it has caused to colleagues, to patients and to families to not be able to have patients' loved ones with them when they are in receipt of care. There will be a very good rationale for the decision that obviously remains in place in outpatients for patients that are receiving chemo, and I can have a stab at what those will be. However, that wouldn't be very helpful. I believe in Grampian we have taken a really strong position around visiting and have managed to maintain the presence of visitors where a number of other boards have not, and that's been down to the work of colleagues in the system. And again, I'm passionate about it, but so are many other people. So that's how we've managed to maintain that. I think probably the best thing to do, because I do think that particularly in our chemotherapy services, the patients and how they feel are absolutely at the centre of their decision making. So my contact into that, Mike, would be Yvonne, just to reach out to her and see what the plans are around that and to have a specific conversation with the team to follow up from this. Yvonne Wright, the chief nurse, I know is really person-centred, has visiting at the centre of her decision making, and she'd be the best person to help colleagues understand. She's also leads on the outpatients work, so she'd be the best person to help colleagues understand when that'll happen.
Okay, thank you. The next one, it's an observation that was sent in actually via social media on Instagram, following a comment that you made in one of the previous videos where you talked about staff retention. And I think the quote that they mentioned was that you'd said we need to do all we can to keep the fantastic staff we already have. The colleague has basically come back and said that to her, the most immediate and significant impact that we could make is to do simple things like the ability to access food at ARI after 2:30 in the afternoon, and to help provide more parking spaces for staff. I know the hot food issue certainly is something that you've raised previously. Is there anything you could comment on about that, Caroline?
Yeah, so this was raised in the first Q&A that we did, Mike, around access to hot food on our hospital sites, not just ARI, but across Grampian. And 2 colleagues in my team, so Paul Allen, Director of Facilities and eHealth, and Tom Power, our Director of People and Culture, are absolutely all over this. There are a number of issues relating to what is it that is possible, what is it that people want, and I believe that we have now put in place a service that is providing food out of hours. Again, Tom would have to update you specifically on what that is. I'm not sure we've got to the absolute end point of where well, in fact, I'm sure we've not got to where we want to get to, and that's across all our sites. But I agree that if we are going to be an organisation that prioritises our colleagues that deliver and support care, we need to start off by doing the basics, which is providing food and fluid to keep you going in the work that you do. What that means for different communities in our workforce will be different, but I am assured that it is being worked through, and that we will have an end point where we have a better provision of food out of hours on our hospital sites. I do wonder, Mike, if it would be useful just to get an update in the brief about where we're at with the work, but recognise it's not as straightforward as I thought it was when I answered the question in the first Q&A, but we're on it. And Mike, remind me of the second point. The first bit was about food. What was the second bit?
It was about car parking issues.
Oh, car parking. Yeah, again, poor Paul Allen. That is his domain, and car parking and office accommodation, 2 topics to really get people animated, and that's because it really matters. I don't in the conversations I have about car parking, I don't necessarily think it's about the convenience. It's about generally people trying to manage the demands from their personal life and meet the demands of work. So I know that parking is an ongoing conversation about how we get that right. It actually hasn't come up for quite a while during the pandemic, but clearly things, as they are mobilising, are starting to be a bit challenging, I would imagine, as this question has been raised. And I'm not sure of any new changes that are on the horizon, Mike, for parking. So again, if there's a specific query, I'm not going to ask Paul to follow up on this one, but if there's any more detail around it from that individuals about specific issues, happy to hear them. But it's interesting that parking's starting to come up, because that just hasn't really been an issue for us over the past couple of years.
Yeah, I think some of that is related. Obviously, you're aware that the multi-storey car park at ARI is open for some staff just now. So I think that has helped a lot. And I would imagine if that changes back to being just a patient and visitor facility, then it will become quite rightly a hot topic again, because there's nothing, everybody can sympathise with the fact that when you go to work, there's a little bit of stress added to your day when, you turn up and can't get a parking space. So, yeah.
Yeah, and I suppose the only thing to say to that the demand that was there for parking, particularly on our hospital sites, whilst absolutely that will remain the case for colleagues that have to be at work, our clinical colleagues, our support colleagues, for those of us, such as me, such as you, Mike, that don't actually have to be physically present all the time, there is ongoing work just now to understand what's the future going to look like. So the demand on parking should be better than it's been in the past. It won't be as reasonable as it's been during COVID, but it should be better than it was pre-COVID.
Yeah, it's a valid point, actually, and I hadn't really thought of that, actually. So, yeah, just moving on to the next question then. It comes in from Steve Marjoribanks, a senior charge nurse in critical care. He's highlighted that in order to maintain a positive and negative pathway during the pandemic, they've effectively, well, they have had to run 2 separate ICUs simultaneously. He mentions various challenges that presents for staffing and managing clinical workloads, especially the fact the units are a bit of a distance apart. He then mentions that he was aware some time ago there was discussion about a new build for critical care being discussed, and he wonders if you are aware of where that's at, or if that's something that's on hold because of the pandemic.
So nice to hear from Steve, and I absolutely recognise the challenge that the accommodation for critical care presents to all colleagues that are working in what was previously medical high dependency, surgical high dependency, and our intensive care units. And I think the work that colleagues have done to support the new demands of COVID have been extraordinary. And so just use the opportunity to say thank you. I also know and have a desire to make the accommodation better. And the conversations I was involved in around this were probably about 3, if not 4 years ago. And it would be fair to say that there have been minimal conversations about it over the past couple of years. However, like many things, COVID has shone a light on the things that we know we need to do differently and get better. I have come to understand the planning that goes into building things like the Baird and Anchor and the previous building around Royal Aberdeen's Children's Hospital and other developments across Grampian is significant. And I'm just going to have to be really honest to say that the ability for us to build new builds is really limited. It's really challenged, and I think and that's for a number of reasons: space, as well as the costs that are associated with new infrastructure, new buildings. However, it remains a really, really important piece of my work with colleagues such as Alan Gray, Paul Allen, Jerry, Adam, and the big infrastructure that sits around planning and building, to make sure that as we design our services, we are really cognizant of the buildings that we need to have, as well as other things, Mike, like the digital infrastructure that actually now means we have opportunities to do things differently with buildings. But specifically relating to Steve's question around critical care and what would a state-of-the-art critical care unit look like, it is certainly up there with a number of other priorities as something that I know we need to have a plan for going into the future. I can't give you any timeframes around that at the moment. However, I will give a commitment clearly that you would be right up the middle of any of those conversations when they get started.
Okay, thank you, Caroline. This question actually comes, and it's a very thorny issue, I'm sure is on a lot of staff's minds. It comes from one of our domestic and portering teams. They've said they've tried to get clarity on this and they're struggling to get a clear answer, and they wonder if you might be able to help either yourself or to direct that somewhere. They've mentioned that infection prevention and control instructions are that when there's a COVID patient on a ward, staff who are not fully vaccinated should not be scheduled to work on those wards. The team are concerned that as there's no legislation that requires staff to identify their vaccine status, how are teams able to identify other people's statuses and adjust rotas accordingly? They've also mentioned a couple of other points around the ethical data protection implications around this. Is there anything you can comment on about that?
Gosh, that's an interesting point, Mike. So, yeah, I will make a comment, but there's work to be done after this to follow up for colleagues at absolute detail. So it would not be my understanding that we should or indeed are identifying those of our colleagues that have chosen for whatever reason not to be vaccinated And so therefore that would make the position that you've described to me difficult to understand. I can understand why perhaps the thought process is there, and I would start from a position of that it's there to try and protect individuals. However, that would not be my understanding as something that we have set out as guidance. They're absolutely right to identify there are a number of confidentiality and issues that would trigger concerns around. So my suggestion is that we seek to understand, and I'm going to ask June Brown to do that on my behalf, seek to understand what is it that colleagues that have heard that information have absolutely been advised. And then really importantly to understand from the colleagues that have, if indeed they have, set that out as an expectation, what it is they're trying to achieve, and then try and find a way around that's not going to compromise the issues that colleagues that have raised this complaint or this concern are experiencing. And let's try and get to the bottom of that, so there's not a frustration or a sense that people are being treated unfairly. So I'll follow this up with June, and we'll get something, Mike, probably via yourself, back to those colleagues if they've chosen to be anonymous.
Okay, thank you, Caroline. The next one is concerning the £20 staff support payment that is on offer, or I think it's normally a £10 staff support payment, but last year, because we didn't do anything in 2020, it was rolled into £20, and it's from Alan Bulcraig, one of the physio team in Murray. I think essentially what he said is his guidance to his team in December was, let's not do anything with this just now. Let's wait till spring when restrictions might have eased, as you rightly predicted. Unfortunately, he says neither he or anybody in the team noticed the notice that went out in the brief on the 17th of December that said we were suspending applications for that payment for a social event, and they've missed out. Now that people are able to gather again for football and rugby, Alan's made that point and asked if we'd be willing to look at it again. Are you aware of any discussions along those lines?
Yeah, I am actually, and it's an issue that's been raised certainly directly with me by a couple of other colleagues. So what I can see I've done is I've had a conversation to understand what the thinking is, and you're absolutely right. So because we set out guidance, regretfully, that people, if possible, should cancel their Christmas festivities, as in team celebrations and nights out, then there was a pause, and that's what it was. It was a pause put on the endowments, and you're right, it's usually £10, I think, that we have. And what I have managed to glean from colleagues that are around endowments is that the first priority was to make sure that people weren't out of pocket. So trying to make sure that we supported those that had possibly lost some money in booking events. But there are a number of teams and individuals that didn't go ahead and book events. And I have been assured that we will be reinstating the opportunity and that people will not be compromised. At the end of the day, we asked for your support and you gave it to us, and it just wouldn't make sense for us not to share the monies that are put aside by endowments for that very purpose. So I think it's a timing thing, Mike, and this, perhaps we could give an update at some point in the brief around the timings of it, because it clearly is an issue that's important. The other thing that was raised with me, so I'll just say this in case anybody else brings it up, was for colleagues that didn't want to go on nights out, etc. What would there be an opportunity to acknowledge or to use the money in a different way? And the example that I was given was for vouchers or something like that. And to me, I thought that was a very pragmatic answer. However, I have since learned that the legal framework that sits around how we spend endowments is very, very robust. And it's really important, as colleagues will understand, that we work within the governance and legal framework around our endowments opportunities. So if things have a specific purpose, that's what they have to be spent on. And I know that our endowments team, however, are absolutely keen to support staff wellbeing in different ways. So there's maybe other opportunities that we can look at, but that specific pot is for the social events that we've been supporting.
Yeah, and I think just on the point you make there about using it differently, Alan, in part of his message, actually mentioned that he'd be more than willing to discuss or to use it for a virtual event, for example, and that might help make things happen. Okay, so I will move on to the next question, which is a really important one, and concerns anti-Semitism, homophobia, and Islamophobia. A colleague has mentioned a specific case, unfortunately, which quite rightly neither you or I, Caroline, can speak about in this type of public forum. It just wouldn't be appropriate. But it does raise a really important issue, as I said, around our commitment as an organisation to equality and diversity. I just wondered, obviously you can't talk about the specific case, but is there anything you could say to reiterate our clear stance on racism and discriminatory behaviour of any kind, Caroline?
Thanks, Mike. And thank you to the colleague for raising this the concern. And clearly, as you said, Mike, I'm not going to comment on specific cases publicly. That's not what this forum is about. However, I am going to be really, really clear that I, and therefore we as an organisation, will not tolerate racism or indeed any other type of discriminatory behaviour. And I will take the opportunity to take action where issues are identified in every circumstance, because no one should be in any doubt that is what working in NHS Grampian means, that will be taken very, very seriously. If I can just go on slightly, Mike, around, because clearly being raised through a Chief Exec Q&A is one way of raising it, but I think it is really important for me to take the opportunity to say I would absolutely encourage everyone who experiences discriminatory behaviour, and let's not pretend that it doesn't happen. We're a huge organisation, so I would strongly encourage everyone that experiences any discriminatory behaviour, or indeed anybody that witnesses it, to make us aware. And there's numerous ways that you can do that. And of course, being able to call it out in the moment is really important. I know it's not easy to do that, but I think it's really important that that is the stance that we take. So for those of you that are unsure what those routes would be, and I would encourage you to have a conversation with your line manager, that can be a supportive conversation and support you in how to handle that. But there are also other options if that's not possible, such things, Mike, as going through HR. We also have our confidential contacts in the system who can help put you in touch with the right people to speak to if you feel you have to do that confidentially. Maybe, Mike, we could put some of those details into the Q&A somehow.
Put them in the description of the video. Yeah, I'll put them underneath the video description and with links. And yeah,
I think unfortunately I can talk to this topic, and I think it's really important that I do, and I have a reasonable level of understanding that more generally I believe that we are and will continue to be an ethnically diverse workforce, and particularly in the north of Scotland. We have, the last time I looked, I think we have a large proportion of ethnic majorities making up a large proportion of our workforce, and knowing the importance of everybody being treated well in our system. I think that's something to be proud of. However, definitely not being complacent, and I know we still have work to do. The fact that this question's being asked is evidence that we still have work to do, and there are multiple strands of work going on around staff equality networks, and to further enhance everybody's understanding about what they can do to contribute to supporting staff diversity. All of which will help us to be an organisation that does not tolerate discriminatory behaviour, and puts it firmly in the past where I absolutely believe it should be, Mike. So I hope that's a helpful answer as a kind of general response to a very specific question.
Yeah, it's really helpful. And I think one of the things that stood out when you spoke there to me was the bit you said about people calling out behaviours when they witness it. And I know from speaking to colleagues who've experienced this type of issue, that makes a massive difference to people. Yeah, so that's really important. So I will move on to the next question. It comes, in fact, it's an anonymous one, but it concerns rehabilitation of patients who are not on the frailty or specialist pathway. The context around this question is basically at present, the questioner says at present priority status is given to patients that are admitted to 102, where they require specialist rehab, or they live in Aberdeenshire and they can access the Shire's community hospital beds. The inadvertent result of that is that means that patients from Aberdeen City do not get access to the same pathway, and they wait disproportionately longer for rehab beds. Is that something you're aware of, or anything that we can address to make it easier and perhaps a bit fairer?
Yeah, so I wouldn't have been able to describe to you that in the detail that a colleague that has raised this has. However, what I could say to you is that access to our rehab services are very challenged, and I know that, and I know the consequences of that comes through to me in a range of ways. It won't be surprising to some, so trying to understand flow in our system, trying to respond to complaints and patient experience. So that's how I know about that, Mike. So like many things, and I've said this already, even in this Q&A, that our COVID has absolutely helped us to identify areas of our system that were fragile before and that need us to look differently at to have a sustainable future. Rehab services are critical. Anybody that has worked in them, or indeed that has needed them, knows the difference that rehab can make to your quality of life. And so the prioritisation, I'm not going to get into that. That will be done with the best of intentions. And if there are specific things that people believe need to be addressed, then conversations with that service need to take place. However, like a number of other services, we need to understand what is Grampian's population rehab requirements, and how in our new strategy and our work going forward are we going to ensure that we have sustainable services that mean all patient populations can get access to high quality rehab services. And I know that colleagues Jason Nichol and Sandra McLeod, who are my kind of contacts around that, are very, very aware of the pressures in that service. So acknowledge the problem, recognise the validity of the concern. Like many of our services, prioritisation has consequences, and that's really difficult for those patients and families that experience that. And the design of rehab services is critical as we come out of the pandemic and reform health services to look different.
Thank you, Caroline. The next question, again, it's one that concerns staff behaviour. Someone's been in touch about one of the recent daily brief documents that went out, and I thought for the day that was written in that one, what I'll actually do, just so people have the context, while I'm reading out the question, I will put on screen the original daily brief paragraph. But the person who's written in has highlighted the fact they used the terms humiliation, they felt humiliated, and that they'd been thrown under the bus at points throughout the pandemic. They've asked if Caroline could comment on the statement in the brief and how you feel about it, Caroline, and if you plan to take any action on it.
Thanks, Mike. And I'm not able to recall the comment, and clearly I'm taking it just at face value. So I suppose the first positive thing is that, although it being anonymous, the person that's chosen to raise this, that's a really positive thing. Going back to the previous question around calling out behaviours when they actually happen. So I'm grateful actually that people feel that they can use this Q&A to raise things, and also grateful that you would have the level of concern clearly that you do for the colleague that chose to communicate their experience in the brief. And of course, nobody in our system should feel humiliated, or did you say thrown under the bus?
Yeah.
And language is an interesting thing, isn't it? So without the context of the message in front of me, then I'm going to say that I think lots of people don't quite recognise the impact that their behaviour can have on others. And nobody should feel thrown under the bus. Common phrase used, and most of us know what that means, and nobody should feel humiliated. And the most important thing is to encourage people that experience that and perceive things that are said to them to give that feedback to the people that are actually using that language at the time, and to help people understand how their actions can, sometimes inadvertently, have a massive impact on how people feel at work. And I think I see examples of this every day. There is no intention to hurt people, but sometimes we're quite careless in the way that we speak. We all make mistakes, I do it. And actually you don't know, if nobody flags that up to you, then how do you know? So I think there is an overarching statement from me, Mike. Nobody in this organisation should feel humiliated or thrown under the bus. Please, if that's how you feel following a conversation, give that feedback to the person that's made you feel like that. That's what will change things, and be really thoughtful about the consequences and the impact that our language, our conversations, our behaviours have on other people.
Thank you, Caroline. Again, it comes back to COVID and social distancing and the restrictions that are in place. They've asked about staff dining areas in particular, the dining rooms at ARI and the Aroma Cafe for staff. Again, is there any plans to move them down to 1 metre? I think that's very similar to the question Lisa from Feedback asked. Is there anything you'd want to add on that one?
Nothing other than I get how frustrating it is not just for colleagues that are trying to use those facilities, but also those that are working in them. When you can go into a cafe in the community and not have to do that. And I know that it's been in the forefront of those that are around those services, how to make that better. So I'm not even going to attempt to answer it any more than that, Mike, and just say we need to put an update along with the update for Lisa around physical distancing in general.
I know some people don't watch the entire Q&A, they will just watch the questions that are relevant to them. So if the person that asked this one, if they go and click on the link description at the bottom, the Lisa Blues question is the one you're looking for. The next one is from Linda Oldroyd. This is more of an observation. She says that when she left school, she worked as an auxiliary nurse. And she says, I was proud to call myself a nurse and people respected the role. She thinks that the move towards the healthcare support worker title has perhaps taken this away a little bit. She thinks it might help with recruitment if we were to start using terms like auxiliary again, rather than what she calls a vague term like healthcare support worker. Do you have any thoughts on that, Caroline?
Yeah, that's an interest. So firstly, Linda, nice to hear from you. Thanks for reaching out. And I too started my career as an auxiliary. And I have to say, I didn't really like being called. I didn't really think that was a great title. And I'm not going to profess to be able to understand what would be better. And actually, I think the people that would be best placed to answer that would be our healthcare support worker colleagues across the system. And I had a great conversation with them actually yesterday, and they have very real and very valid pride in the roles that they hold. So yeah, I mean, anything that we can do to think about and if it means about changing things, then to recruit and attract, in particular, colleagues who are currently in our healthcare support worker community. I've said numerous times, Mike, on this and in other conversations, that we haven't got it right for that part of our workforce. And I know that from the consistent turnover in vacancies. So how can we make that better? The things that I absolutely do agree with Linda on are identity. And within that identity, titles are really, really important to people, irrespective of what job they do. So if there's something about clarity of identity and that can be affected by title, I am up for anything that we need to do. And as a chief nurse, Linda is in a key influencing and negotiating position around that. So yeah, I think I've mentioned before about how are we going to make sure we are an organisation that recruits, attracts and retains colleagues who would like a career in health, right through the range of roles that healthcare support workers support us with. So all ideas are welcome around that, but I will restate the people best placed to answer what should it look like are those in those roles themselves.
Absolutely, yeah. Okay, I think this is the final question, actually. Yes.
My goodness, Mike, I'm needing a drink of water.
Indeed,
this is quite diverse, these questions, I think.
I know, and so yeah, the last question, it's an anonymous one. And I suspect it's going to be one that you're going to need to get advice because it's quite specific. The person has said that they cannot use Microsoft Teams for the getting it right for every child meetings. And that's partly because they do have to invite parents onto the calls routinely. But there are privacy and confidentiality issues with the software, she's been told at least. Where the confusion comes, I think, and the frustration comes is that local authority colleagues are able to use Microsoft Teams for the same thing. She can't understand the difference. She also mentions that the current video conferencing options that they are forced to use cause a lot of issues with people being kicked off the call. Are you able to talk at all about that, or is that something we'll need to get some advice on?
No, I can have a, so firstly, how frustrating, and if we don't have the right kit to do the job, then it's just an additional stressor that we don't need. Like the colleague that's mentioned this, I don't quite understand. What I do know is that although we use MS Teams, we have different licenses in local authority and in health, and that's for a number of reasons that I won't bore you all with. But we have different licenses and then access to different things. I don't need to rehearse the frustrations around the different systems that we have, and wouldn't it be beautiful if we had systems that all interlinked, and we're trying really hard to make that happen. However, the issues that this colleague is describing are sortable, if that is a word, and I think we just need to get a bit of support in there to actually understand the problem, because the information governance, being kicked off, so having probably experienced a range of these issues, I can have a flavour of the different solutions that are around this. However, bottom line, we need to give you the right tools to do the job. We're asking people to work virtually. There are other examples where virtual interactions and confidential conversations happen very, very well. So let's, Mike, if the colleague wants to remain anonymous, we'll do our work through you. But I think that we can get to the bottom of it and come up with some solutions. And my contact around that would be Paul Allen, who will help me to identify the right person to have the conversation around getting this sorted.
We'll have to make sure Paul watches this video then, because there's a few come up from him, I think.
Well, tell him, Paul, tell him to have a cup of tea when he's sitting watching it, because he'll end up with a big action list.
Indeed. Okay, just to finish off today, so thank everyone again for watching. Really grateful for your attention, and I hope you continue to find these sessions useful. The volume of questions seems to indicate that you are. I think we have no more outstanding questions. We've answered them all. So if anybody has any more, we'll do another session in a couple of weeks' time, perhaps. So if you send those in, and we'd also be grateful for any feedback about how we're doing this, how we can improve it. If there are future sessions you'd like us to do on specific themes, we'd love to hear from you. Otherwise, I will just finish there and say goodbye.
Thanks, Mike.